Hi everyone, welcome back to the channel. Welcome back to the podcast. I'm Julia, registered dietitian, helping you heal your skin inside out through evidence-based nutrition, lifestyle, and mindset. So grab your coffee, matcha, or tea, and let's dive into today's episode. So this is a highly requested episode, and today we're going to talk about how do you know if you're just dealing with eczema or you're going through TSW. This is also a question that I get often with my clients because I do have lots of clients that not only have eczema, but because they have topical steroid history, sometimes their eczema can actually look like TSW. Now, before we dive into the episode, I just want to mention a disclaimer. This episode is for educational purposes only. It's not to diagnose TSW. Topical steroid withdrawal is still evolving in research. My goal as a dietitian is to help you understand your body, not to diagnose. And so if you do have questions, concerns about your health, whether or not you have TSW, then please reach out to your medical provider. So in this episode, we're going to talk about what is eczema, what it looks like and how it presents, what is topical steroid withdrawal, the symptoms and what to look out for, why it's so confusing to know the difference between eczema and TSW, and certain things that can point one to the other. I'm also going to share my story because I actually experienced both. I went through TSW about 10 years ago in 2015 and I was born with eczema. So I do have experience with both, and I'm going to share my experience as to when I started to notice it was more TSW over eczema and vice versa. And I'm also going to dive into what someone should do if they think they have TSW. If you're someone dealing with eczema and you have topical steroid history, then make sure you watch this video until the very end. So eczema or atopic dermatitis is an inflammatory skin condition. In the past, eczema was thought to be just a skin condition, which is why topical steroids, topical creams are often prescribed, even to this day. We now know with the evolving research, with the microbiome, the immune system, and nutrition, that eczema is no longer just a skin condition, and it's also not just a condition because of your genetics. Eczema is a multifactorial condition, meaning that there's multiple different root causes that can cause eczema and also trigger flares. Genetics do play a role, but so does microbiome imbalances, gut dysfunction, stress, an overactive immune system, in which eczema is a Th dominant condition, meaning people with eczema tend to lean more towards one spectrum of the immune system. People with eczema tend to react to the environment or tend to react to food. So when there's weather changes, season changes, irritants in the air, sweat, these are all things that can be a trigger for eczema. And eczema typically usually appears in patches. So we'll see the common areas like your elbow creases, behind the knees, on the neck, behind the neck. And while eczema has a spectrum, so mild, moderate to severe, I would say the mild eczema are usually localized in certain areas. So for example, for me, I actually have a small patch of eczema on my ring finger. I'm just showing you guys on video if you're watching this on video. So that's eczema because it's showing up in small patches. I also get patches in between my elbow creases, behind the knees. Those are the main areas that I used to get eczema as a child as well. And typically with eczema, it comes and goes. So depending on what the root causes are or what your triggers are, it comes and goes. It should be able to heal within a reasonable amount of time, given that you're on a good protocol to help support healing. Diet and lifestyle also does impact eczema. So typically eczema will flare if there are changes to your diet and lifestyle, more of that chronic sort of lifestyle, meaning we see eczema in people who are highly stressed, who have a go, go, go sort of lifestyle that relates to the nervous system. We also see eczema tends to flare if there's been chronic history of restrictive dieting or just not getting enough nutrition in your diet. But usually with adjustments to nutrition and lifestyle, the eczema will typically heal. Of course, the timeline for when it heals is different case to case. With mild eczema, it typically tends to heal faster. And of course, the more severe it is, the longer it takes to heal. However, I have seen clinical cases in my practice where the eczema was initially very severe, very widespread. And after implementing the right protocol, our clients have been able to improve within a matter of weeks, which sounds insane and sounds kind of crazy, but we have definitely seen those type of cases. I remember a client case specifically for this. She had widespread eczema across her neck and chest. I'm sharing your picture here with permission. It was quite widespread, and we'll talk about TSW symptoms, but she actually had pretty severe eczema. Once we determined what her root causes were through nutrition assessment, clinical assessments, looking at her blood work, she actually was experiencing a lot of chronic stress as well as fungal overgrowth. So once we addressed that through mindset work, nervous system practice, practices and prescribing certain supplements, she saw a miraculous change within just 3 weeks. Here's a before and after picture of what her skin looked like after just 1 month. So whether or not you have mild, moderate, or severe eczema, it is very possible to heal. So that's eczema. We know there are multiple different root causes, and it's often impacted by diet and lifestyle, but sometimes it can be a little bit more complicated. It's not just changing your diet or managing your stress. We do want to look at the microbiome, digestion, any nutrient deficiencies that can be possible with eczema. I have tons of other episodes on the channel, so make sure you check them out if you want to learn more about root causes. Okay, so topical steroid withdrawal is really different. First, we're going to talk about what are topical steroids. Topical steroids are prescription creams that you would get from your dermatologist or from your GP. You can even get it without a prescription, and it's often used for eczema, also other inflammatory skin conditions, even rosacea, psoriasis. While it can be effective in reducing inflammation, we know that with topical creams, it's a band-aid solution. It doesn't actually get to the root cause of why you developed the inflammation in the first place. Most GPs and dermatologists, they aren't very knowledgeable around root causes and around the other factors that can impact your eczema. So they will usually resort to a topical cream, and if that doesn't work, they'll usually go on to the next medication, whether it's an immunosuppressant or a biologic. So the problem with topical steroids is that if they're used for a long period of time, it can lead to something called topical steroid withdrawal. TSW is a condition that is caused by the overuse of topical steroids. And I just want to mention that if you are on steroids, I don't want to scare you. I don't want you to feel like it's your fault that you are using steroids. As patients and as someone with eczema myself, this is something that we are not informed by our doctors and dermatologists. We follow the prescription, we follow the recommendation without really knowing the true side effects. Now there's more research and more information about TSW. TSW is a condition when people stop using the topical steroids on their skin, particularly after a prolonged use, so frequent application over the years or even after a few months. After they discontinue the topical steroids, they notice rebound symptoms. Some of the common symptoms that are often seen with TSW is a presentation of bright red skin. It feels like a sunburn and it's quite widespread. Now, the longer that you're off topical steroids, the more that you're going to notice symptoms. And this is the challenging part because you really don't know that you're going through TSW until you're in it. Meaning, if you're just a few weeks off of topical steroids, it's really hard to tell if it's TSW or if it's eczema. It's usually over a period of time, people start to notice these symptoms creep up. My journey, for example, 10 years ago, there was not a lot of information about TSW. So when I stopped using the steroids and I went to cold turkey, my symptoms crept up to me. So the first few weeks, my eczema was getting worse, but I just thought it was just eczema. Then the 4th, 5th, 6th week, I started to notice the rashes started spreading. So it went from a patch in my elbow creases and then it became a full red sleeve. We're going to take a quick break. I wanted to take a moment to talk about something I see all the time as a root cause dietitian. So many people are struggling with gut issues, eczema, inflammation, fatigue, blood sugar imbalance, you name it. And they've tried everything under the sun, but nothing is really sticking. They go to the doctor's office and the first thing they're given is a medication or a steroid to help their skin. And there's not a lot of conversation about addressing symptoms from a root cause perspective. And this is where I come in. I help people as a dietitian to get to the root cause of exactly what's going on and create a practical, personalized nutrition plan that actually makes a difference. No strict protocols, no restrictive dieting, and no detoxes. Just a clear plan that you can actually follow that is sustainable. And this is exactly what we do inside our group and one-on-one coaching services. We help our clients feel better in their bodies and actually become symptom-free. If this is something that you've been looking for, I would love to work with you. You can simply book a free consultation in the show notes below. The consultation is for me to understand your health goals, where you're feeling stuck, and how we might be able to support you. I would love to help you feel better, confident in your body, confident in your skin, and confident in yourself by healing from the inside out. Now, this is not a program that will just tell you what to do. This is a program where we work with you. We are by your side the entire time. We help you understand your symptoms and your body, and we combine nutrition with mind-body medicine. I'll leave the link in the show notes below for you to book a free call. Now, back to the episode. There's actually a really good resource called ITSAN.org. They support everyone that is going through TSW or suspect that they have TSW. ITSAN was literally my lifesaver during my TSW days back in 2015 because it was basically the only thing that really existed. For those of you who went through TSW 10 years ago, you know about ITSAN. They also used to have a forum. So you could go into the forum and meet other people going through TSW, because back then there wasn't much on social media. So they had the forum. My OG TSW warriors, you guys know. I'm sharing my screen here and I'm just showing you what TSW is, and they explain it very, very well. So the common symptoms that you may notice with TSW. Before you discontinue topical steroids, you'll notice rebound redness between applications, rashes spreading and developing in new areas of the body. That's a big one. We see that pretty often with some of our clients. Intense itching, burning, and stinging. Failure to clear with usual course of treatment, requiring a higher potency topical steroid to achieve progressively less clearing, and increase allergic response. After continuing topical steroids, skin flushing bright red, resembling a sunburn, visible and measurable flaking of the skin cycling between oozing, swelling, burning, and flaking, red sleeves. And here's the other list of symptoms that I won't read out because there's quite a bit. I'll just point out the ones that I see early on with my clients where they suspect that they're going through TSW. Definitely the rashes spreading in new areas of the body. They will notice that on topical steroids, but also when they discontinue. To notice flares in new areas that they've never had eczema before. That being said, this is where it's confusing because eczema can also do that as well. But TSW is different because the spreading is quite rapid, I would say, and it's more widespread. So with eczema, you can get, patches here and there. Usually they're smaller patches, whereas TSW is quite widespread because it is more of a systemic issue. Red sleeves are also pretty common that we see in practice. One of the most obvious signs of TSW, I would say. Excessive flaking. This is a big one. While eczema does flake, TSW usually flakes a lot. Feels like it's snowing, which is actually one of the symptoms that is listed here. The other thing we notice is definitely thermal regulation. So a lot of our patients going through TSW, they can't regulate their temperature. So they're feeling cold, then they're feeling hot, especially in the evening when they're trying to sleep. It's like almost impossible because of the heat that they're experiencing from their body. Another one that's quite obvious is nerve pain. Sometimes it's described as zingers, or it feels like pins and needles under the skin. I just want to mention these symptoms. You may not notice them until you have longer time without using the topical steroid, which is why, as I said earlier, I didn't start to notice my symptoms until 4, 5, 6, 7 months later on. I personally never experienced nerve pain, but I did experience red sleeves, oozing, excessive flaking. I did lose a lot of hair, and hair loss is something that I experienced maybe at the 6 to 8 month mark. I also completely lost my period for a full year and a half. So yeah, topical steroids can do systemic damage. So I'll leave the ITSAN.org link in the description below so you can read more about TSW. There's a couple of things I want to mention with TSW as well. Is I don't want to scare anybody to think that just because you use topical steroids means that you're going to go through TSW. They can be used safely and effectively. Now again, please check with your doctor or dermatologist in deciding how to use topical steroids and whether it is something that will be helpful for your case. But what I will say as a dietitian who has worked with a lot of patients over the last 6 years in my practice is that eczema is definitely something that you can put into remission and you can heal from without relying on medications. And we have a lot of success stories from achieving this. That being said, there are definitely times when medications are needed and indicated. And we also have patients who are focusing on the holistic side of things when it comes to eczema and TSW while on medications at the same time. It's not one or the other, like you have to use topical steroids or you have to go all natural. Sometimes using a combination of both conventional and functional treatments can actually promote faster healing. And while there's no diagnosis yet for TSW, TSW is still evolving, the research is evolving, there's a lot more support and resources now than ever before. And in fact, this is really exciting news that was announced, I think a few months ago. TSW is actually going to have its own medical code. And this is so important and honestly, like probably the biggest change in TSW research, where now there's a diagnostic code, meaning that clinicians, doctors, dermatologists can now document TSW in medical records. In the past, if you are going through TSW, you would go to your doctor and they would just write in your medical record, it's just unexplainable eczema or severe eczema. In 2027 in the US, not sure when this is going to happen in Canada yet for my Canadian listeners, physicians will have to formally document the withdrawal and they can't just write eczema. That is huge. Really excited for that. Okay, so let's talk a little bit about why it's really confusing to determine the differences between eczema and TSW. We know that TSW can tend to creep up with the symptoms, and if you are going through TSW, those symptoms typically worsen over time. However, there are overlap symptoms between both. Both eczema and TSW can have red skin, inflamed skin, oozing skin, flaky skin, cracking, itching. They both can experience infections. Eczema, when it's severe, can also be widespread. It can show up everywhere on the skin, just like that example I showed you with my client who had eczema all over her chest and neck. Yes, it is really hard to tell the difference, which is why history is really important. Topical steroid history, medical history, which is why when I'm assessing my new clients, I do ask about topical steroids very specifically, and my clients know this. I'm very specific with how often they use topical steroids, when was the last time, how many years, how many months. That can guide us in thinking about, okay, is this potentially TSW or is it just eczema? And again, this is not diagnostic, but typically what we see in patients that lean more towards eczema, and I mentioned this earlier when I was explaining what eczema is, eczema has a presentation where it shows up in certain areas of the body. Typically, it's in the elbow creases, it's behind the knees, it's on the neck. Sometimes there's dyshydrotic eczema, so you notice eczema on the fingers and fluid-filled bumps. Severe eczema can show up on the chest, on the neck. Generally speaking, eczema looks more patchy. And because eczema has different root causes, it's often triggered by stress, microbiome changes, triggered by your diet and lifestyle. It does come and go, and typically it should improve with proper treatment. On the other hand, things that might point towards TSW is if we see a long history of topical steroid use. We also do see it with shorter term use of topical steroids, and those ones are a little bit more challenging, which is why we have to not only look at medical history, we also want to look at symptoms as well. If you notice your rash is spreading after stopping topical steroids, excessive flaking, excessive oozing, thermal dysregulation, all of the symptoms that was shown on the ITSAN.org are helpful clues. The other thing that I hear often is my patients will tell me, this doesn't feel like eczema. This feels different. Could be TSW when they share that, because eczema typically has a pattern over the years. It's not too different. TSW is sort of all over the place. It's a roller coaster. I did share a little bit about my own journey and what TSW looked like for me. As I mentioned, when I stopped topical steroids unknowingly, what TSW even was, my symptoms didn't creep up around the 4 to 5 week mark. And that's when I started to notice red sleeves. My eczema patches was spreading more and more. I did have a long-standing history of topical steroids. That's a big clue for me because I used steroids for about 10 to 15 years of my life, and I used the most potent steroid, clobetasol. So I did go through TSW for sure. And then over time, I think it was around the 3rd, 4th, 5th month, I knew for sure I was going through TSW because I had the oozing, the cracking, the deep bone itch. My skin was definitely burning. It couldn't touch water or moisturizers. And then I think around the 6th month to the 1 year mark, I noticed that my periods disappeared. So I did lose my period for a full year and a half, I think, almost 2 years. I lost a lot of weight, 15 pounds. I lost a lot of hair. And I also went through eczema herpeticum, which is a viral skin infection that is pretty common with TSW, but also eczema as well. So again, there's definitely overlap. My experience very different from someone else going through TSW. So again, this is just me sharing what I went through. I personally didn't have nerve pain, which I know a lot of people going through TSW have. And I also didn't experience thermoregulation. So I didn't have any issues with heat or feeling cold. So what should you do if, everything that I've shared today that you may suspect that you have TSW? First and foremost, don't scroll on TikTok, don't scroll on social media. There's a lot of information. It can be really scary. And again, just because you use topical steroids doesn't necessarily mean you're going through it. But I would say it's important to document your symptoms and document your history. So your topical steroid history, how long, how frequent, notice how your skin changes with or without the steroid. If you have a good doctor, bring your documents, show them this is what you're noticing. Cold turkey isn't the best method either. It can actually be unsafe if you cold turkey topical steroids. There are people that have tapered off topical steroids and that has been effective, because if TSW were to happen, it's not something that everybody can go through. It's really challenging. It's debilitating. A lot of people end up leaving work. They have to quit their jobs. They have to stay at home. It's a crippling condition. So it's not for everybody to go through, which is why medications are indicated and people go on Dupixent or immunosuppressants just to have their life back, right? So there's nothing wrong with being on medications. Again, this episode is just really to share for educational purposes only, and because I've been getting a lot of questions about the difference between the two, but the choice is always up to the patient and what you feel like is the best choice for you. A lot of listeners, I would imagine, want to go all natural and want to heal naturally, but sometimes medications are needed. Sometimes TSW isn't something that people can go through. So don't feel like there's only one route. Tons of my clients are healing their body naturally, but also on Dupixent. So there are ways to support you, whether or not you are on topical steroids or you're trying to figure out sort of the next steps. Final takeaway for this episode, I guess there's quite a lot. There are differences between eczema and TSW, but there's also overlap. So make sure you check out ITSAN.org to read up more about TSW. It's okay if you don't have all the answers. It's okay if you don't know. There is hope to heal from both eczema and TSW. Make sure you're getting the right support. I support a lot of patients with TSW and eczema, and also those who are still on topical steroids and trying to figure out the next steps. So if you want to book a free consult to see what working together would look like, then I'll leave that in the show notes below. If you found this video helpful, you know of someone that has eczema or maybe going through TSW, then make sure you share it to them. Don't forget to hit subscribe for weekly videos if you're watching this on YouTube, and give this video a thumbs up. If you could also leave us a review on Apple Podcasts or Spotify, that would really help the podcast in growing and reaching more people who are needing help for eczema or for TSW. Thank you so much for being here, and we will see you in the next episode.